We now begin a discussion on an issue making headlines. The World Health Organization in Geneva reported over the weekend that Sunday marked the largest single-day increase in coronavirus cases. It recorded more than 183,000 new cases in 24 hours, with Brazil and the United States reporting the highest number of cases. The organization said that the spread of the virus is accelerating and that the world is entering a new and dangerous phase. Meanwhile, over here in South Korea, health officials have said that we're now experiencing a second wave. So during this trying time full of uncertainty, we're going to ask experts today what we can make of the current situation and what to expect. We speak with Dr. Stanley Perlman, Professor of Microbiology and Immunology at the University of Iowa, who has been studying coronaviruses for nearly 40 years, and Dr. Bruce Wiley, Professor of Health Policy and Management at City University, New York, who is a systems modeler and a senior contributor for Forbes. Now, my first question to you, Dr. Perlman. So after all these months, why isn't the coronavirus subsiding at all?
Well, I don't think it's subsiding for two reasons. First of all, the virus is very contagious. And second of all, we've relaxed some of the measures that were preventing it from not spreading as much. So people are congregating more, they're going back to work. So it's not a big surprise that the number of new cases is not subsiding.
And Dr. Lee, well, here in South Korea, as I mentioned before, we've seen cluster infections springing up again, and the transmissions, they do seem to be a lot stronger than before. We've seen third and even fourth-hand infections. Do you think it's possible that the virus has actually gotten stronger?
It is possible that the virus has changed and become more contagious or stronger, but the other possibility is the fact that many people in the population still have not been exposed to the virus. So that leaves them susceptible to infection. So if you have a lot of susceptible people around and the virus reappears or continues to spread, it can spread very fast and very quickly. So it's unclear whether this might be due to the fact that the virus has changed substantially or just the fact that you have many susceptible people in the population.
Well, as you mentioned, yes, a large portion of the Korean population hasn't been exposed to the coronavirus yet. And, well, Dr. Perlman, we heard a couple of days ago that immunity against COVID-19 might just last 2 to 3 months and that the resilience of antibodies differs from person to person. Does this mean that we can't really count on growing immunity if we contract COVID-19?
Well, I think that number is an average, and we have to think about what it means. So for people who have been severely ill with virus, I think it's way longer than 2 to 3 months. Certainly studies from even the common cold coronavirus, which is a very weak virus, shows that you have immunity for at least a year. And I think what we're seeing is that people with very, very mild infection may have their immunity wane after a couple of months, 2 or 3 months, but we don't know that those people are actually fully susceptible to the infection because they probably have what we call memory antibody responses and T-cell responses, which may be protective. So those numbers, of course, are concerning that they're waning after 2 to 3 months, but that's going to be in people who have very, very mild infection, unlikely to be true for people who have severe infection, and what it means, time will tell.
Well, Dr. Lee, where you are in New York City has allowed companies to reopen their offices on Monday after a 3-month lockdown. But are people there willing to go back straight away? And, well, what are health experts like yourself recommending or advising decision makers there to do?
Well, it does range from people who have to go to work, so they have to return to the open workplaces and the businesses. And it ranges from them to people who are very hesitant for obvious reasons because the virus is continuing to circulate. The virus has not gone away. And even though we've seen maybe a plateauing, in some cases a downturn in terms of number of cases, transmission is still occurring. And a lot of the reopening is more due to economic pressures to try to get businesses to reopen. So one of the key things is to remember is this reopening is occurring because of economic pressures and not because the virus has gone away. So you have to continue to maintain social distancing, continue to potentially wear masks if that may be helpful, continue to wash your hands, actively disinfect surfaces and objects, and remember that the virus has not gone away. That's one of the reasons why the World Health Organization, the WHO, has warned that this is a very dangerous period that we're entering, because many people are getting social distancing fatigue. So they're tired of staying separate. And it can be tempting to go back to how life was before the pandemic, but that's not the case. So you have to actually continue to be careful, because if that happens, then the virus could spread quite rapidly.
Well, I want to ask this question to both of you, but why don't we start with you, Dr. Perlman? How can we then prepare for a potentially deadlier second wave? Should we get perhaps vaccine shots for other illnesses that could help us during that critical period?
Yeah, well, I think certainly if we're protected against influenza, we'll have less confusion about whether somebody comes in with COVID-19 or someone comes in with influenza. So I think that's a good step. I think equally important is making sure that the measures that we did that worked before are still being followed. We socially distance. We wash our hands a lot. We protect ourselves. People really think now that wearing masks is a good idea. Wearing face shields is even a better idea. So doing these kind of simple things that may not be a complete hindrance on normal life are really important to do. Having the right kinds of medical equipment, so we have the PPEs in hospitals. And I think we're all worried about a second wave. If we get a vaccine, we hope that that'll increase herd immunity immensely and quickly so that we can protect our most vulnerable populations, which are still the aged and people with comorbidities. But I think that we need to really respect the possibility of a second wave, and I'm not sure that's being done by governments everywhere.
Well, Dr. Perlman, some do say that novel coronaviruses, they could become a regular phenomenon that we see every 4 to 5 years. Do you think that's possible? And if that does happen, then do you think we're going to see the cycle of mass infections and lockdowns again?
Yeah, I don't think you can predict the time, because what we've seen so far in every case, or at least the ones, the SARS cases, not MERS so much, these are viruses that originally started in bats in China, and then they cross species to infect humans. So there's several of them around. We don't know how well they would all infect humans. We certainly have to be wary. This one took 8 years to occur, or actually 17 years from the last SARS epidemic. So we have to be careful. I don't think we can say it's going to be 4 to 5 years. It can be 2 years. It can be 10 years. I think it's just being aware and starting to develop protocols for treating these infections when they enter human populations. Having more experience with antivirals will be important. Having better vaccine platforms, because we know after this one we're going to know a lot about which vaccine platforms are most effective. And those are the things I think that we have to do to really try to minimize the likelihood of a new coronavirus causing as much disease and economic damage as this one did.
Well, hopefully we can take these lessons forward. Well, Dr. Lee, what do you think we can do to protect ourselves or really strengthen our immunity during a second wave?
So one thing is to stay healthy, because if you have other medical problems, other types of diseases, then you're more susceptible to worse COVID-19 outcomes if you do get infected. So you want to maintain your health and do things to stay healthy, whether that means being physically active, maintaining your diet, making sure that you get the recommended immunizations and take care of any health problems that you may have.
I see. So if we have other conditions, then that could make it worse. So we perhaps should take those other vaccine shots. Well, Dr. Perlman, what do you think we can learn from this unpredictable virus that we can apply to better prepare for future epidemics? Do you think that requires better support for scientists so that they can continue to conduct research and develop maybe better prediction and prevention methods?
Yeah, I think that's an important thing to do. I think one of the challenges here is I don't think everyone knew how devastating this disease would be. So there was certainly hints that coronaviruses could cross species and like to cross species. But in the past, when they did so, in the case of SARS and MERS, they were bad diseases, but they mostly affected the lower lungs, and people weren't contagious until they were already quite ill. Here we're having a disease that transmits in the upper airway like common colds. So this was not predictable. So just like SARS in 2003 was really a wake-up call for diseases that get spread by the respiratory route, this is in a way a wake-up call for diseases that can spread both by the upper and lower airways, and how we have to really devote resources to trying to develop antivirals and vaccines that may be efficacious if this occurs again.
And finally, before we go, as I said, Dr. Perlman, we've heard over the weekend that there was the highest number of daily infection cases on Sunday reported by the WHO. But it seems that a lot of world leaders aren't taking this very seriously, and they're continuing to ease lockdowns at a rather very hasty pace. Does this worry you as a scientist?
Well, I think that we expected that this was going to happen because the lockdown was only going to be effective for a certain period of time, even though we would have liked cases to have resolved to much lower levels. So I think it was predictable. I think it's very important that leaders, that people who can, government leaders, and I think healthcare people believe this, but government leaders just have to really take this all seriously and make it very clear that returning to life as normal is not the way, what we can do to protect ourselves from this infection. And again, it's not really the people, young people, who are most vulnerable. Certainly some of them develop very bad disease and die, but it's really those vulnerable populations. We want to prevent the infection, or we want to get to a point where there's a vaccine so that young people are all protected against it and they're less likely to spread to vulnerable populations who may not be able to actually even respond to the vaccine as well as the young people. So I think people have to be really serious about this and cautious, and that's what they, and right now, and follow the measures that I mentioned earlier.
I see they're going to really have to accept that this is the new normal, as they're saying. We're not going to go back to the way things were before, obviously, with this pandemic. Well, Dr. Stanley Perlman and Dr. Bruce Wiley joining us from Iowa and New York. Thank you so much for your insights.
Thank you.
This is also where we wrap up the show. Thank you for watching.